organismic valuing, natural, undistorted, full-body reaction to an experience. Joseph Wolpe. Originated systematic desensitization. Z-score tells how many SDs away from the mean score is. Lewin argued that psychology should not only increase the scientific understanding of human behavior but should also improve the quality of human life. He aimed to take psychology out of the laboratory and into the social world. Edward Titchener. One student came to U.S., questioned mental experiences associated with structuralism, asked people their thoughts but no way to verify. Inductive thought, going from specific facts or observations to general principles. Deductive thought, going from general principles to specific situations. Response cost, removal of a positive reinforcer after a response. Structuralism, introspective theory of mind used by Titchener but impossible to verify. William James. Focused on learning how people produce useful behaviors. Functionalism. Focused on behaviors reacted against structuralism. Psychophysical. Description of relationship between physical properties of a stimulus and its perceived properties. Darwin's animal intelligence. The theory of natural selection gave interest to animal studies. People sought to measure and compare intelligences. John Watson, associated with rise of behaviorism, focused on the observable versus mental processes. Artifact, an error caused by improper statistical manipulation of experimental data or a logical flaw in experimental design, an intended variable. Content validity, method in social research for assessing the validity of an instrument or scale. Physiological explanation. Describes the mechanisms that produce a behavior. Central nervous system, brain and spinal cord. Peripheral nervous system, bundles of nerves between spinal cord and rest of body. Somatic nervous system connects to skin and muscles. Autonomic nervous system connects to heart, stomach, and organs. Occipital lobe, specialized for vision. Temporal lobe, complex aspects of vision, hearing. Amygdala, emotional situations. Parietal lobe, processes sensory information that had to do with taste, temperature, and touch. Primary somatosensory cortex, sensitive to touch and different body areas. Medulla, carries out and regulates life-sustaining functions such as breathing, swallowing, and heart rate. Cerebellum, responsible for balance and coordination of muscles and the body. Hypothalamus, motivated behaviors responsible for behaviors such as hunger and thirst as well as the maintenance of body temperature. Hippocampus, responsible for processing of long-term memory and emotional responses. Thalamus, diagnoses sensory input and redirects, responsible for relaying information from the sensory receptors to proper areas of the brain where it can be processed. Corpus callosum, connects the right and left hemispheres of the brain. Prefrontal cortex, decision-making area of brain. Autonomic nervous system, controls the internal organs such as the heart. It has two parts, the sympathetic nervous system which deals with fight-flight activities and the parasympathetic nervous system promotes activities that occur during relaxation. Endocrine system is a set of glands that produce hormones which alter activity in organs. Signal detection theory. The study of people's tendencies to make its correct rejections, misses, and false alarms. Subliminal perception. The idea that stimuli sometimes influence our behavior even when they are presented so faintly that we do not consciously perceive them. There is a possibility of unconscious influences. Feature detector theory. Idea that we see features separately. Gestalt, seeing as a whole. Heritability, An estimate of the variance within a population that is due to heredity. Heritability ranges from 1 heredity controls all variance to 0 controls none of it. Multiplier effect. A small initial advantage in some behavior alters the environment and magnifies that advantage. Habituation, decreased response to a repeated stimulus. Cross-sectional study, compares groups of individuals of different ages at the same time. Longitudinal study, follows a single group of individuals as they develop. Selective attrition, the tendency for certain kinds of people to drop out of a study. Sequential. Researchers start with groups of people at different ages studied at the same time and then study them again at later times. Cohort effects. A group of people born at a particular time or belong to a certain group will have different experiences than others. Schema. According to Piaget, an organized way of interacting with objects. Assimilation. Applying an old schema to new objects or problems. Accommodation. Modifying an old schema to fit a new object or problem. Equilibration. Establishment of harmony or balance between assimilation and accommodation. Sensory motor stage. Birth to 2 years, behavior is mostly simple motor responses to sensory stimuli. They lack object permanence and develop a sense of self at the end of this stage. Pre-operational stage. The child lacks operations or reversible mental processes, egocentrism, and has some troubles distinguishing between appearance and reality. Do not have the concept of conservation. Concrete operational. Children can perform mental operations on concrete objects but have trouble with abstract or hypothetical ideas. Formal operational. Can reason logically about abstract and hypothetical concepts, develop strategies, and plans actions in advance. Vygotsky zone of proximal development. The distance between what a child can do alone and what the child can do with help. Use scaffolding in the zone to increase children's knowledge. Erikson. Infant stage. Basic trust versus mistrust. Toddler stage. Autonomy versus shamed out. Preschool child stage. Initiative v. guilt. Pre-adolescent stage. Industry v. inferiority. Adolescent stage. Identity v. role confusion. Young adult stage. Intimacy v. isolation. Middle adult stage. Generativity v. stagnation. Older adult stage. Ego-integrity v. despair. Perry. Kagan. Lifespan developmental model includes the idea that cognitive thought procedure results in growth. His 6 stages of lifespan development include incorporative, impulsive, imperial, interpersonal, institutional, and interindividual. Eric Fromm had idea that the 5 basic needs are relatedness, transcendence, rootedness, identity, and frame of orientation. Behaviorism. Study only observable, measurable behaviors, not mental processes. Methodological behaviorists. Study only the events that they can measure and observe, but sometimes use those observations to infer internal events. Radical behaviorists. Don't deny internal events exist but don't consider them helpful. They deny that hunger, fear, or other internal events cause hunger. Classical conditioning. The process by which an organism learns a new association between 2 stimuli, a neutral stimulus and one that already evokes a reflexive response. Acquisition. The process that establishes or strengthens a conditioned response. Extinction. Decrease or extinguish CR through training. Stimulus generalization. Extension of a CR from the training stimulus to similar stimuli. Stimulus discrimination. Responding differently because 2 stimuli predict different outcomes. Operant conditioning. The process of changing behavior by providing reinforcement after a response. Reinforcement. process of increasing the future probability of a response. Disequilibrium principle of reinforcement. Each of us has a state of equilibrium in which we divide our time among various activities. If you have had a limited opportunity to engage in one behavior, any opportunity to increase that behavior and return to equilibrium will be reinforcing. Primary reinforcer. An unconditioned reinforce is reinforcing because of its own properties like food or water. Secondary reinforcer. Conditioned to be reinforcing because of previous experience. Punishment decreases the probability of a response. Positive reinforcement. Presentation of an event that strengthens likelihood of behavior. Negative reinforcement. Absence of a negative to increase behavior. Omission training. Taking away something good to decrease a behavior. Passive avoidance learning. A bad thing occurs to decrease a behavior. Shaping. A technique to establish a new response by reinforcing successive approximations to it. Chaining. Reinforcing each behavior with the opportunity to engage in the next one. You start by teaching final behavior, then moving one step back. Continuous reinforcement. Providing reinforcement for every correct response. Fixed ratio reinforcement. Reinforcement following completion of a specific number of responses. Variable ratio. Reinforcement for an unpredictable number of responses that varies around a mean value. Fixed interval. Reinforcement for the first response that follows a given delay since the previous reinforcement. Variable interval. Reinforcement for the first response that follows an unpredictable delay since the previous reinforcement. Behavior modification or applied behavior analysis. A psychologist tries to remove the reinforcers for unwanted behaviors and provide reinforcements for more acceptable behaviors. Preparedness. The idea that evolution has prepared us to learn some associations more easily than others. Social learning approach. We learn about many behaviors by observing the behavior of others. Vicarious punishment reinforcement. Substituting someone else's experience for your own. Reinforcement stronger than punishment. Self-efficacy. The belief of being able to perform the task successfully. Free recall. Produce a response. Cued recall. Produce a response with the help of hints about the material. Recognition. Chooses the correct item among several names. Savings. Comparing the speed of original learning to the speed of relearning. Implicit memory. An experience influences what you say or do even though you might not be aware of it. Explicit memory. Someone who states an answer regards it as a memory. Procedural memory. Memories of motor skills. Declarative memory. Memories we can readily state in words. Information processing model. Info enters your memory and is processed, coded, and stored. Short-term memory. Temporary storage of recent events. Long-term memory. A relatively permanent store can be semantic memories of principles and facts or episodic memory for specific events in your life. Source amnesia. Forgetting where you learned something. Chunking. Grouping items into meaningful sequences or clusters. Working memory. System for working with current information like listening to someone speak, visualizing. Levels of processing principle. How easily you retrieve a memory depends on the number and types of associations you form. Retrieval cues. Reminders, associations that stimulate memory of something. Encoding specificity principle. The associations you form at the time of learning will be the most effective retrieval cues later. State-dependent memory. The tendency to remember something better if your body is in the same condition during recall as it was during the original learning. Mnemonic device. Any memory aid that relies on encoding each item in a special way. Reconstruction. During an original experience, we construct a memory. When we retrieve that memory, we reconstruct an account based partly on memories and partly on expectations. Hindsight bias. The tendency to mold our recollection of the past to fit how events later turned out. Amnesia can result from damage to the hippocampus, which damages explicit memory and declarative memory. It can also result from prefrontal cortex damage, which results in lots of confabulations, attempts to fill in gaps in memory using out-of-date info. Infant amnesia. The seeming loss of memory of early childhood. Several theories but none completely steadfast. Attention. Your tendency to respond to and to remember some stimuli more than others at a given time. Pretentive process. Something stands out immediately. Attentive process. You must search for something to find it, like Where's Waldo? Attention bottleneck. The idea that attention is limited and things compete for your attention. You cannot plan two actions at once, and doing two things often interferes with one another. Change blindness. The failure to detect changes in parts of a scene. Attentional blink. During a brief time after perceiving one stimulus, it is difficult to attend to something else. ADD. Easy distraction and impulsiveness. Prototype. Familiar or typical examples. Priming. A concept or idea gets thinking started so it's easier to recognize think of related items. Algorithm. Mechanical, repetitive procedure for solving a problem or testing every hypothesis. Heuristics. Strategies for simplifying a problem and generating a satisfactory guess. Maximizing. Decision-making based on thoroughly considering every possibility to find the best one. Satisficing. Searching only until you find something satisfactory. Representativeness heuristic. Assumption that an item that resembles members of some category is probably also in that category. Base rate information. Consider how common categories are when deciding whether or not something new fits within them. Availability heuristic. Tendency to assume that if we easily think of examples in a category, the category must be common. Critical thinking. The careful evaluation of evidence for and against any conclusion. Confirmation bias. Tendency to err by accepting a hypothesis and then looking for evidence to support it instead of considering other possibilities. Functional fixedness. The tendency to adhere to a single approach use. Framing effect. The tendency to answer a question differently when it is framed or phrased differently. Sunk cost effect. The willingness to do something because of money effort already spent. Transformational grammar. Chomsky's idea that we have a system for converting a deep structure into a surface structure based on idea of a language acquisition device, a built-in mechanism for acquiring language. Wernicke's aphasia. A condition marked by impaired recall of nouns and comprehension of language, inability to speak fluently. Broca's aphasia. A condition characterized by difficulties in language production. Phoneme. Unit of sound such as f or sh. Morpheme. A unit of meaning such as thrill. Psychometric approach. The measurement of individual differences in performance used by Spearman. He argued people had a general ability term G and then other tasks can require specific abilities. His theory is monarchic because it includes the dominant ability. Spearman, G idea of intelligence. Fluid intelligence. Kittal's idea of the power of reasoning and using information. Crystallized intelligence. Kittal's idea of acquired skills and knowledge and the ability to apply that knowledge in specific situations. Hierarchical models of intelligence. Idea that G could consist of multiple subabilities or levels. Gardner. Idea of multiple intelligences, unrelated forms of intelligences such as logical, musical, social, movement, etc. Sternberg. Triarchic theory: three aspects of intelligence including analytical, creative, and practical, unsupported by data. Aptitude, ability to learn. Achievement, what you already know. Mental age, the average age of children who perform as well as this child. Standardization, the process of evaluating the questions, establishing rules for administering a test, and interpreting the scores. Norms, descriptions of how frequently various scores occur. Flynn effect, tendency for raw scores on IQ tests to increase decade by decade. Reliability, the repeatability of its scores. Validity, the degree to which evidence and theory support the interpretations of test scores for intended purpose. Does a test what it's supposed to test? Bias test, overstates or understates the true performance of one or more groups. Consciousness, the subjective experience of perceiving oneself and surroundings. Parasomnia, a disorder characterized by abnormal or unusual behavior of the nervous system during sleep. Freud thought each dream has hidden meanings and reveals our unconscious thoughts, with manifest content that appears on surface and latent content which is represented symbolically. Activation synthesis theory, dreams are an accidental byproduct of arousals during REM sleep. Neurocognitive theory, dreams are kind of thinking that occurs under special conditions like sleep. Hypnosis, a condition of increased suggestibility that occurs in the context of a special relationship between subject-hypnotist. It resembles ordinary suggestibility, can produce relaxation, concentration, and some changes in behavior. Results are mixed. Motivation, the process that determines the reinforcement value of an outcome, what makes you want something more or less. Drive, state of unrest or irritation that energizes behavior. Drive reduction theory, popular but flawed idea that we are motivated to reduce our needs. Allostatus, maintaining levels of biological conditions that vary according to an individual's needs circumstances. Homeostasis, maintenance of an optimum level of biological conditions within an organism. Incentives, external stimuli that pull us toward certain actions. Extrinsic motivation, based on reinforcement and punishments that the act may bring. Intrinsic motivation, motivation to do an act for its own sake. Maslow hierarchy of needs, idea that we satisfy most insistent needs first until reaching self-actualization. Glucose, most abundant sugar in blood, important energy source for body, nearly only energy source for brain. Insulin, increases flow of glucose and other nutrients into body cells. Mere measurement effect, simply estimating your probability of doing some desirable activity increases your probability of that action. Need for achievement, set high but reasonable goals. Scientific method to job design, idea that most employees are lazy, indifferent, and work should be foolproof and supervised. Human relations method to job design, employees like variety, sense of accomplishment, should have responsibility for meaningful tasks. Transformational leader, articulates a vision of the future, intellectually stimulates subordinates, and motivates them to advance the organization. Transcational leader, tries to make the organization more efficient at doing what it is already doing. Microexpressions, very brief, sudden emotional expressions which are hard to control. James Lang theory, your interpretation of a stimulus evokes autonomic changes and sometimes muscle actions. Your perception of those changes is a feeling aspect of emotion. Schachter and Singer theory of emotion, the intensity of the physiological state determines the intensity of the emotion, but a cognitive appraisal of the situation identifies the type of emotion. Fredrickson, a happy mood increases your readiness to explore new ideas and opportunities. Anxiety, Increase in the startle reflex depends on amygdala. Stress. Kohlberg. His theory of morality, people gradually develop tendencies toward altruistic behavior. Evaluate moral reasoning of reasons given for decision, not decision itself. Can be pre-conventional, conventional, or post-conventional. Bystander apathy. People are less likely to help someone if others are in an equally good position to help, much like social loafing. Attribution. Set of thought processes we use to assign causes to our own behavior and that of others. Internal attribution. Explanations based on someone's individual characteristics. External attribution. Explanation based on situation. Fundamental attribution error. Error of making internal attributions for people's behavior even when we see evidence for an external influence on behavior. Actor-observer effect. People are more likely to make internal attributions for other people's behavior and more likely to make external attributions for their own. Self-handicapping strategies. Intentionally putting oneself at a disadvantage to provide an excuse for failure. Self-serving biases. Attributions that we adopt to maximize credit for success and minimize blame for failure. Attitude. A like or dislike that influences our behavior. Cognitive dissonance. State of unpleasant tension experienced when one holds contradictory attitudes or behavior contradicts a stated attitude. Central route to persuasion. When you take a decision seriously, you invest the time and effort to evaluate the evidence and logic behind each message. Peripheral route to persuasion. When listening to a message on an unimportant topic, they attend more to superficial factors such as speaker's appearance or reputation. Sleeper effect. Delayed persuasion by an initially rejected message. Forewarning effect. Tendency that simply informing people that they are about to hear a persuasive speech activates their resistance and weakens the persuasion. Inoculation effect. People first hear a weak argument and then a stronger argument supporting the same conclusion and are less likely to believe it. Conformity experiments. Ash's experiment with lines. A third of the time, a participant conformed to an incorrect answer when surrounded with people giving that answer. Milgram experiment. Delivering maximum shocks to learners higher obedience in situations where lots of people appear to be going along with it. Responsibility lessened. Group polarization. If nearly everyone in a group discussion agrees on an issue, the discussion leads them to a more extreme viewpoint. Groupthink. Members of a group suppress their doubts about a group's decision for fear of making a bad impression or disrupting group harmony. Humanistic psychology deals with consciousness, values, abstract beliefs, including spiritual experiences. Carl Rogers. He thought people are naturally good, strive toward the achievement of full potential. Logotherapy. Meaning-oriented philosophy and treatment method developed in 1967 by Viktor Frankl and others and used by members of many disciplines to help people search for the humanistic and spiritual significance of their lives. Id. To Freud, sexual and other biological drives. Ego. To Freud, the rational, decision-making aspect. Superego. To Freud, memory of rules and prohibitions we learned. Psychodynamic theory relates personality to the interplay of conflicting forces within the individual, including unconscious ones. Psychoanalysis. Method of dealing with personality based on the interplay of conscious and unconscious forces. Reaction formation. To Freud, presenting oneself as the opposite of what they really are. Sublimation. To Freud, transformation of sexual or aggressive energies into culturally acceptable behaviors. Karen Horney. Neo-Freudian remains faithful to parts of his theory and updated it to be a study of feminine psychology, etc. Carl Jung. Collective unconscious pertains to the cumulative experience of preceding generations, focused on search for spiritual meaning and the continuity of human experience. Adler. Individual psychology, ideas of inferiority complexes and striving for superiority. Healthiest goal is seeking success for yourself as part of a larger group, having social interest. Nomothetic. Seek general laws about various aspects of personalities, like that there is a thing called extroversion and we vary in our degree of it. Idiographic. Personality study that focused on individual state, temporary activation of a particular behavior. Trait. Consistent, long-lasting tendency of behavior. Self-esteem. One's evaluation of one's own abilities, performance, and worth. The Big Five personality traits. Barnum effect. Tendency to accept vague descriptions of our personality. MMPI. Most widely used personality test uses true-false questions intended to measure certain personality dimensions and clinical conditions. Myers-Briggs, based on Jungian theory, classifies into 16 personality types, used more for fun or employment than diagnosis by psychs. Projective techniques, designed to encourage people to project their personality characteristics onto ambiguous stimuli like the inkblot test or thematic apperception test. Inkblot is basically invalid. Thematic is up for interpretation. Biopsychosocial model. Abnormal behavior has three major aspects: biological, psychological, and social. DSM. Psychotherapy. A treatment of psychological disorders by methods that include a personal relationship between a trained therapist and a client. Psychodynamic principles. Attempt to relate personality to the interplay of conflicting impulses within the individual. Transference. Transfer onto the therapist the feelings they originally established toward their father, mother, important person. Behavior therapy begins with clear, well-defined behavioral goals and then attempts to achieve those goals through learning. Cognitive therapy seeks to improve people's psychological well-being by changing their thoughts and beliefs. Rational emotive behavior therapy assumes that thoughts lead to emotions. Cognitive behavioral therapy, combining behavior and cognitive therapy by setting goals for changing people's behavior and also on changing interpretation of the situation. Person-centered therapy. Non-directive therapy. Therapist listens to the client with total acceptance and unconditional positive regard. Family systems therapy. Assumption is people's problems develop in a family setting and thus is the best way to deal with them to improve relationships and communication. Tarasov ruling. A therapist who has reason to believe a client is dangerous must take steps to prevent harm. Insanity defense. Must be so disordered that you do not understand what you are doing. Systematic desensitization. Method of reducing fear by gradually exposing people to the object. Harm reduction. Concentrates on decreasing the frequency of drug use and minimizing the harmful consequences even without abstinence. Major depression. 2 weeks or more of little interest, pleasure, motivation, activity, or ability to concentrate. Tricyclic drugs. Block reabsorption of neurotransmitters dopamine, norepinephrine, and serotonin after release to prolong effect of these neurotransmitters. SSRIs. Block reuptake of serotonin. MAOIs. Block metabolic breakdown of released dopamine, norepinephrine, and serotonin by the enzyme monoamine oxidase. EST. Unclear how it works. Electric shock administered to induce a convulsion similar to epilepsy. Positive symptoms. Behaviors notable by presence. Negative symptoms. Behaviors notable by absence. Hallucinations. Perceptions that do not correspond to anything in the objective world. Delusions. Unfounded beliefs such as persecution, grandeur, reference. Bandura agreed with ideas about classical and operant conditioning and added that mediating processes occur between stimuli and responses and that behavior is learned through environment through process of observational learning. Byrne, founder of transactional analysis, he asserted that these states are marked by experiences and emotions that relate to behavior patterns. The basis of transactional analysis is that each person possesses the three independent and observable ego states of parent, adult, and child. Dollard and Miller consider habits the basic core of personality. Habits express the combined effects of drive, cue, response, and reward. Stroboscopic motion, also known as phi effect, visual effect that makes still things look in motion, like a series of lights flashing at different times, looks connected. Wilhelm Wundt, organismic valuing, natural, undistorted, full-body reaction to an experience. Joseph Wolpe originated systematic desensitization. Z-score tells how many SDs away from the mean a score is. Lewin argued that psychology should not only increase the scientific understanding of human behavior but should also improve the quality of human life. He aimed to take psychology out of the laboratory and into the social world. Edward Titchener, one student came to U.S., questioned mental experiences associated with structuralism, asked people their thoughts but no way to verify. Inductive thought, going from specific facts or observations to general principles. Deductive thought, going from general principles to specific situations. Response cost, removal of a positive reinforcer after a response. Structuralism, introspective theory of mind used by Titchener but impossible to verify. William James focused on learning how people produce useful behaviors. Functionalism focused on behaviors, reacted against structuralism. Psychophysical description of relationship between physical properties of a stimulus and its perceived properties. Darwin's animal intelligence, the theory of natural selection, gave interest to animal studies. People sought to measure and compare intelligences. John Watson, associated with rise of behaviorism, focused on the observable versus mental processes. Artifact, an error caused by improper statistical manipulation of experimental data or a logical flaw in experimental design, an intended variable. Content validity, method in social research for assessing the validity of an instrument or scale. Physiological explanation describes the mechanisms that produce a behavior. Central nervous system, brain and spinal cord. Peripheral nervous system, bundles of nerves between spinal cord and rest of body. Somatic nervous system connects to skin and muscles. Autonomic nervous system connects to heart, stomach, and organs. Occipital lobe, specialized for vision. Temporal lobe, complex aspects of vision, hearing. Amygdala, emotional situations. Parietal lobe processes sensory information that had to do with taste, temperature, and touch. Primary somatosensory cortex, sensitive to touch and different body areas. Medulla carries out and regulates life-sustaining functions such as breathing, swallowing, and heart rate. Cerebellum, responsible for balance and coordination of muscles and the body. Hypothalamus, motivated behaviors responsible for behaviors such as hunger and thirst, as well as the maintenance of body temperature. Hippocampus, responsible for processing of long-term memory and emotional responses. Thalamus, diagnoses sensory input and redirects, responsible for relaying information from the sensory receptors to proper areas of the brain where it can be processed. Corpus callosum, connects the right and left hemispheres of the brain. Prefrontal cortex, decision-making area of brain. Autonomic nervous system, controls the internal organs such as the heart. It has two parts, the sympathetic nervous system which deals with fight-flight activities and the parasympathetic nervous system promotes activities that occur during relaxation. Endocrine system is a set of glands that produce hormones which alter activity in organs. Signal detection theory, the study of people's tendencies to make its correct rejections, misses, and false alarms. Subliminal perception, the idea that stimuli sometimes influence our behavior even when they are presented so faintly that we do not consciously perceive them. There is a possibility of unconscious influences. Feature detector theory, idea that we see features separately. Gestalt, seeing as a whole. Heritability, an estimate of the variance within a population that is due to heredity. Heritability ranges from 1, heredity controls all variance, to 0, controls none of it. Multiplier effect, a small initial advantage in some behavior alters the environment and magnifies that advantage. Habituation, decreased response to a repeated stimulus. Cross-sectional study, compares groups of individuals of different ages at the same time. Longitudinal study, follows a single group of individuals as they develop. Selective attrition, the tendency for certain kinds of people to drop out of a study. Sequential, researchers start with groups of people at different ages, studied at the same time, and then study them again at later